In a significant milestone in the fight against HIV prevalence in Lagos, the State Ministry of Health has announced the ART Impact Survey, a nationwide public health assessment designed to evaluate the progress and effectiveness of antiretroviral therapy services for people living with HIV/AIDS. At a town hall meeting held in Lagos on September 23, 2025, with the theme "Every Step Counts Towards an HIV-Free Nigeria," the Lagos state government sensitized military personnel, health experts, community leaders, and other stakeholders on the importance of the survey. During her keynote address, Director of Disease Control at the Lagos State Ministry of Health urged community leaders and military personnel to cooperate with survey officials, reduce respondent refusals, encourage participation, and dispel misconceptions.
We want to be certain that everybody has access to universal health coverage, including generous, warm, happy people living with HIV/AIDS. They deserve to be treated with respect. They deserve to be able to walk into the facility and not be scared of stigmatization. So as the Lagos state government, with funding from CDC and our warm implementing partners, we're here to take this step forward, to be able to say the service you receive in Lagos State will be universal, will cover what you require, and there will be no fear of stigmatization. But we also understand that we can't do that all alone, and that's why we have you here in the room with us. You are all critical stakeholders, whether you work in security, whether you're in the community, whether you're in the facilities. You're all critical stakeholders, and we believe that this advocacy town hall meeting will ensure that you go back to wherever it is you are, be it in the community, be it in the health facilities, with the right information to say that there are people coming around who want to conduct a survey. There's no need to be scared about this. You just need to understand that if we don't have the information, then we cannot evaluate and make progress.
And as has been mentioned this morning, the Nigeria State Level ART Impact Survey is a cross-sectional, household-based, state-level representative survey that would be done amongst adults aged 15 to 64 years across 3 high-burden states: Akwa Ibom, Lagos, and Rivers. So the survey started last year in Akwa Ibom. The data collection was done, and now we're at the point where we're finalizing the survey in Akwa Ibom, and we're starting in Lagos State. So for Lagos, we're at the point where we want to go into the field to collect data, and subsequently we'll be moving on to Rivers State to conduct the survey.
Non-governmental organizations pledged support for the exercise, stressing the importance of accurate data for effective policy making.
This activity actually is ours, and we are happy that it has come to Lagos, and NEPWAN is ready to give all necessary support that is required for this survey to be successful. And I call on everyone to put on their effort to do the right thing in the field, especially, I don't know if the community people are here that are going to carry out these activities. They need to be on the ground, and we want to get the right data. There's always the issue of data, different data here, different data here. But this time around, we want to see the data that is from Lagos, and I think that will help in policy making in Nigeria.
One of the problems that we had with HIV before was the fact that people thought that it was that disease that could not be cured. They will call it Logun, right? No, it's no longer like that. It's just something that can be managed. The fact that we have what we call antiretrovirals now means that people can live as long as possible. Just the way that you treat diabetes, the way you treat hypertension, is the way we treat HIV now. So based on that, people already know there's that awareness, and we are trying to use this survey to also improve that awareness, so people will know that the survey, the HIV/AIDS is no longer what it used to be. Right now, it is surmountable, and with the provision of ARVs, it can be managed.
Lagos health officials assured residents of strict confidentiality, noting that while the state records one of the highest numbers of people living with HIV/AIDS in Nigeria, HIV is not a death sentence. They emphasized that greater awareness can help reduce new infections and end stigma and discrimination.
Well, the target is to get up-to-date information about the HIV program, the number of people that are on treatment, the effect of that treatment, the effect of the impact of the services and the drug treatments that have been provided in Lagos State.
Lagos State has a prevalence of 1.4. The disease burden in Lagos, the last survey that was done in 2018, the Nigeria Indicator and Impact Survey has Lagos as one of the 7 top states that are having the highest burden of HIV and AIDS in the country. And then because Lagos State has a lot of structure, and then the large immigration of people into the state actually push up the Lagos State HIV prevalence to that level. And more importantly, we have a very large number of people on treatment in Lagos. We have 135,225 people currently on treatment in Lagos, which is one of the highest in the country. So that actually put Lagos at the point which everybody wants to see how we can actually reduce the infection in the state.
Military personnel and community leaders pledged their resources to ensure the success of the ART Impact Survey, aligning with its vision of an AIDS-free Nigeria, one with 0 new infections, 0 stigma and discrimination, and 0 AIDS-related deaths. Joy Huchejim, TV 360, Lagos.